I have a story where I had a little Pomeranian. He was very spoiled, aggressive, cute, and the owner had lots of clothing and brought him to a mall to take photos with Santa. And the Santa, evidently, who the dog tried to bite, didn't ask the dog what he wanted for Christmas, and the client was yelling at the Santa. And I just thought, okay, please. Like, she's like, isn't that crazy? And I said, well, yes, it is, for entirely different reasons. So,
welcome back to the Pause and Effect podcast. I'm your host, Dr. Cara. I'm excited to introduce today's guest, Dr. Dawn Filos, a seasoned veterinarian with over 31 years of experience. She's here to talk about her upcoming book, Tales of a Pet Vet, Stories from the Clinic and House Calls, which is filled with heartfelt stories from her time as a vet. If you've loved books like Marley and Me or works of James Herriot, you'll want to stick around for this one. A very warm welcome to Dr. Filos, Dawn Filos, who is a US soon-to-be author. Well, you are an author, but soon-to-be published author of The Tales of a Pet Vet, Stories from the vet and the clinic. What is it? Home visits and the clinic.
The clinic and house calls. Yeah.
Okay. So let's clarify. Give us your intro.
My book is called Tales of a Pet Vet. It's stories from the house call and clinic. I've been practicing about 32 years, and the last 10 years have been house calls. And my book's about that. I could explain more.
A very warm welcome. Thank you for joining me on the Pause and Effect podcast. I'm very excited to speak to you. This is a wonderful thing that you're doing, is giving insight into being a vet and the experiences that you had, both from, I'm sure, some difficult perspectives and some wonderful memories that I'm sure you've had from the work that you've done. Is that correct? Is that what inspired you to write a book?
Well, yeah. What inspired me to write this book was a number of things. I had a blog, actually, because I really enjoyed teaching. I really enjoyed being able to take the time to make sure my clients understood what was going on, that they left feeling confident. And that I wasn't always able to do that in the short span of a brick and mortar practice. It part related to the fact that reason for me to start my house call practice as well. And the blog started with just veterinary information. And then I started sharing personal anecdotes and the human animal bond and funny stories and stories about how poorly trained my pets were. And I would get a lot more feedback on those subjects. And I came to realize that people wanted to hear more about those stories. So the book started from that, some topics of popular blogs, and the stories are driven by veterinary information it's not heavy on information, but as needed to drive and explain the background in the stories.
I love that. And I mean, did you find it therapeutic? I mean, when I read it, or when I come across vets that have written or enjoy writing, I often think that must be quite therapeutic to go home, and whether it's been a great day or a terrible day, not only to keep the memory alive, but also just to work through what's happened and sort of clarify in your head. Did it provide you with that kind of opportunity?
It did, 100%. I didn't always enjoy writing, but in the last 20 years, it's very therapeutic, and journaling, and it's journaling about experiences and cases. And I'm so glad that I've done it, and I'm glad I got it on paper, because, you think you are going to remember all of these stories, but you don't always. And another thing that, in my career, I'm sure you've done this, where you tell your friends, you're not going to believe this story and this story. And you kind of get real-time feedback on what stories are more interesting or shocking or funny. And so I hope I picked the most relatable for the book.
Were there stories that and I only come to this because you say that, when you're telling stories, particularly to your colleagues, sometimes I've found in a social situation, particularly if I've been in the presence of another vet or a nurse or one of the veterinary professionals, that some of the conversations we have
Yeah.
are quite shocking. Some of the insights that we have, and we talk about it very casually, and some people are like,
It's
that's gross, or that's sad, and we talk about it just normally because we're used to it, but that giving that insight to a lot of people gives them just maybe a better idea of the kind of work that we're doing and some of the
agree.
challenges that we
And, I
face.
admit, and I joke, because there's a lot of humor in the book. There's a lot of, not so, heartwarming, heartbreaking, but I talk about it. There's a lot of gross things, in this career. This is a career where you don't dress up really well for good reason. But it's a challenge. It's exciting to me. It's not for everyone. Here's what you can expect if you want to be a veterinarian. This is what it's like. It's like a week or a day in the life throughout the book. So I want people to have an appreciation for what we go through, how much we love what we do, how much we care, kind of see it through my eyes as a veterinarian, but also as a pet parent. And in my case, and all of us, an imperfect pet parent. So when I share these stories, I want to make it clear I'm poking fun at myself quite a bit and my family, when I feel it gives me liberty to share some of the more extreme cases where, I have an eccentric client chapter. And so I did change some names, but some of them are appropriate to share and kind of just funny and out there. And I think that helps present a picture. It's not all puppies. It's not and kittens. It's not all euthanasias. It's not all medicine. Sometimes it's just crazy, and add to that house calls and the unknown. It makes for a very interesting day at work. I would say. I'm sure you would agree.
Absolutely.
Exactly.
Well, every day is different, isn't it? That's the beauty of what we do. And I mean, you've obviously been practicing for many years. You gave it away in the first part of our conversation. How have things changed? Do you give some insight into how veterinary practice has evolved, and how things were historically different and the challenges that we face as a result?
Yes, to me, I mean, the span of my career and my life, I would say that I've seen pet ownership and things, the most dramatic changes, I'd say there were four, in my career. There are just more pets. So I feel like there are just more and more of them. And I'm finding that the populations here in the US, although it's a worldwide phenomenon, but here there are more pets being adopted from shelters. And so along with that, which is great, there are more no-kill shelters, but you're seeing more patients with behavioral issues or pre-existing medical conditions. And it's heartwarming to see the increase in people that are willing to commit to the time and effort it takes to adopt these pets. Not all rescues are special needs in these departments, but many are. And I see people, in my lifetime and career, pets are part of the family. They are treated as well, if not better, than some human children. Sometimes they are a substitute for that. And just the other most dramatic thing that I'm fascinated with and am entertained are just the ways you can spoil your pets and the experiences and the special invite dog parks. And out here in New York, we have, just you can pay to have your dog have swimming lessons, private swimming lessons, and the clothing options. It's just,
Wow.
it's a great time to be a pet. in this day and age. I think, I always say I want to
go to a
I want to come
party.
back as a pet and, a spoiled pet, because they're living some great lives and they deserve it. It's just, that shift is more. Pet parents wasn't a term I had heard of growing up. And now I'm a pet parent. Everybody says that, or it's very common.
Hello, I'm Dr. Cara, a veterinarian and the host of the Pause and Effect podcast. Our show is all about enhancing the lives of pets by providing reliable, science-based advice and engaging in discussions with experts in veterinary medicine, pet nutrition, and animal behavior. As a professional with years of experience in both the UK and South Africa, I run a 24-hour veterinary hospital and an online pet store. I'm also pursuing a master's in animal nutrition and consult for UltraPet, a local veterinary-grade pet food manufacturer. My passion lies in sharing knowledge and helping pet owners make informed decisions about their pet companions. The Pause and Effect podcast is rapidly growing, attracting a dedicated and engaging audience of pet owners who are passionate about their pets' health and well-being. Our listeners trust us for credible, informative content that empowers them to provide the best care for their animals. We are looking for sponsors who share our commitment to pet health and who want to reach a highly engaged and expanding audience. Partnering with us means aligning your brand with trusted and influential content that resonates deeply with pet owners. As a sponsor, you'll benefit from high visibility on a platform that is used for multiple purposes, including educational content, product recommendations, and community building. We offer various sponsorship packages designed to fit your marketing goals and budget, ensuring that your brand gets the reach and the impact it deserves. Join us in making a difference in the lives of pets and their families. Let's work together to bring valuable insights and quality products to our passionate audience. If you're interested in sponsoring the Pause and Effect podcast, please get in touch. I look forward to partnering with you. Before we continue, let's address a critical aspect of pet care, gastric health. Introducing UltraPet's special diet gastric liquid care, formulated to aid pets during recovery from gastrointestinal issues. This versatile product boasts a balanced formulation with 31% protein, 9% fat, and 3% fiber, replenishing key nutrients essential for pets recovering from gastric issues. Featuring a delicious chicken flavor, it is highly palatable, encouraging pets to eat during recovery. I've had great success using this both with tube feeding and syringe feeding patients. What sets this liquid care apart is its comprehensive approach to pet health, with added prebiotics for digestive health and omega-3 and 6 for immune support. It is a holistic solution for upset stomachs. UltraPet's gastric liquid care comes in a 750-gram pack, providing an optimal solution for pets in need. Give it a try and witness the difference it makes to your pet's recovery. Your companions will thank you, and you'll appreciate UltraPet's dedication to pet health. Now let's return to our conversation. So you have taken on the role of being a pet parent, even as a vet, sort of knowing some of the concerns, behavioral issues associated with that kind of mindset. Are you quite communicative about some of the issues associated with that, or has everybody sort of embraced it, particularly in the US?
You mean referring to ourselves as pet parents?
Not necessarily even referring, but perhaps behaving like pet parents. So, I mean, I'll give an example so that you know where I'm coming from. But we found like a lot of people who say that the dogs are going to sleep in the bed. And then some of the behavioral things associated with that is that they monopolize that bed. And I have one client in particular who says the dog will not allow her husband to get in the bed. And it's this big joke and it's all very funny. But for me, my eyes just go wide and I go, that is a concern, because if you did have, say, your child, or you had a slightly larger breed dog that can do harm, that is sort of setting up potential issues going forward. So, I mean, I love all the excitement that goes with the parenting concept. And I think we are heading that way in South Africa, but we are a little bit behind. And I just wonder whether you're seeing some of the problems associated with that mindset.
Definitely. They can take it to extreme and, become irrational, emotional, as you might with your human child. And, we're on the receiving end of that. I'm getting the calls at 2 a.m. because, it's an anal gland emergent, things that are not, that could be put in perspective. I think all the emotions are scaled up, and certain parts of the country, I think it's more extreme than others. And for example, I've gotten poison ivy from my dog several times. My dog's on the cat, but my dogs don't sleep in bed with me. We had a dog that did, with my brother growing up, and the dog became territorial. So it's one of those creating a problem where there was none. And so these are behavioral and issues such as you're describing, are more prevalent and a part of daily practice, fielding them that I might not have had to beforehand. And there's all sorts of humorous examples, and there's also problematic examples that just add variety. But, a few years ago, it would have been the first time hearing that, but now it's kind of commonplace, and we have now easily answer those questions because we get them quite often.
Absolutely. And do you think that there's going to be sort of a recognition of some of those things and then just the modification? Do you think it's just a sign of the times, or do you think that this is a ever sort of a continuously evolving trend that's we're going to become more engaged and more connected with our pets, because they give back? I mean, we all love our children, but they eventually leave us, as do our pets, unfortunately, probably in a similar time frame, in some respects. But we definitely are seeing far more pet parents, which does mean better healthcare, but it's definitely putting challenges on us as professionals in terms of, like you say, the communication and the treatment of these pets and these clients.
Exactly. And I do think, you're 100% right. We are veterinary medicine. We can offer more, and each client, they vary in what they're willing to do, but more and more clients are willing to do more, seeing their pets as part of the family. So we have to at least, be able to offer that. And with that comes costs, and that's a whole other topic of discussion. But I do think that it's here to stay. I can't imagine it getting any more fever pitched than it is, at least here in the US. But I talk about in my book, Tales of a Pet Vet, I talk quite a bit about this and this reason for this anthropomorphization of pets in the family. And so you see people, at least here, my kids' generation, they're delaying starting families and being parents to human children because they're establishing their career. So during that delay, I find there's the population of pet owners, there's a lot of younger pet owners that are living not yet married, and this is their family. We have these families that are spread out all over the country, and they have this companion that keeps them company, protects them. They spoil them, and I'm seeing a lot of that. And then on the other end of the spectrum, you have parents like me who, each time a child leaves for college, they get another dog or cat or something and they have this empty nest syndrome where they want to continue to nurture, or they're waiting for grandchildren, or they don't see them as often. So there's this combination, and they approach veterinary care and picking their veterinarian and so forth very differently. And we have to be there for each part of the population of pet owners, pet parents, and address them as they want to connect with them and provide the care that they expect. And it's different for each of them, but it's an interesting shift, and I enjoy it. Some people, most people are, in my opinion, I think it's life affirming and heartwarming to see what they are willing to do for their animals, because I grew up like that. I grew up with this crazy, eccentric, animal fanatic family. And I realized not everyone was like us, but one of the reasons I talk about in the early part of my childhood that led to being a vet is our dog when I was young was hit by a car and had complicated surgery and needed to go to this famous animal medical center facility in Manhattan. I lived outside of the city, and I'm like, these people are just like us, they do anything. And it really inspired me to do this in my career. And so I think that now a lot of people in the United States or in the world are more like my family was in the 70s and 60s. And it's a good thing most of the time.
Absolutely. And in Tales of the Pet Vet, are people able to get a bit of an insight into you as an individual? Do you share your thoughts and your opinions on particular things, or is this generally just some of the memorable sort of situations you've come across? Do you give insight or your feelings about things?
I do. I try not to go into too many hot topics, but for example, I wonder if you agree, but I am not a fan of flexi leashes. I have stories about things that happen to me and pets, and I weigh in on that. I do weigh in on just topics about here in the U.S. getting a dog from a breeder versus a rescue. Some people judge you. How could you buy a dog? There's all these rescues, and I've done both. So I sort of weigh in on the pros and cons of both. I think that, it's really fun for me to see some of these trends, with dressing the dogs, but I kind of have to laugh at people that have 500 outfits, for their pets. And some of I think some people, when they take it a bit far, like I have a story where I had a little Pomeranian. I don't know if it's even in the book, but like he was very, spoiled, aggressive, cute. And the owner had lots of clothing and brought him to a mall to take photos with Santa, which we do here. And the Santa evidently, who the dog tried to bite, didn't ask the dog what he wanted for Christmas. And the client was yelling at the Santa. And I just thought, okay, please.
No.
Like, she's like, isn't that crazy? And I said, well, yes, it is, for entirely different reasons. So, some of us take the brunt of this more than others. I feel terrible for that poor Santa.
Poor Santa, not only bitten, but berated. Oh, shame. So a lot of these stories are humorous, and that's great. I love that because one of the things that we also try and do a lot is to kind of make light of some of the situations, particularly when we're dealing with life and death. Do you tackle some of the difficult subjects like end of life and making those tough decisions during maybe emergency type situations? Do you tackle any of that in the book in order to?
I do. So in my table of contents, it kind of shows the format of the book. But for example, I have an entire chapter on euthanasias because based on feedback from clients and readers, I talk about the process, the options, and I always have stories that sort of explain scenarios, part with information and part with stories. I thought that was very important. And I've had some early readers of my book read that chapter before they euthanized their dog because recently they had never been through it and they found it helpful. I did a lot of that with the house calls because I did a lot of in-home euthanasias and hospice. And that's very important part of my practice and to get it right. I also had a lot of feedback from a blog about pet trusts, and near and dear to my heart are senior pets and senior clients, and trying to I have a lot of senior clients by virtue of the house call practice, and I met many, many more of them in that capacity. They can't drive and so forth. And so it's important for them to be comfortable having a pet, but having a plan for that pet if they should pass. And so that is a chapter devoted to that. And I have a chapter on emergencies. One of the important things to me, the goal when I taught some pet first aid courses was to try to impress upon people to know what's normal so they can recognize abnormal, that they call their veterinarians err on the side of caution, because a problem picked up and treated early can be cheaper and easier to fix than waiting 3 days and being that Monday morning vet who sees the cardiac emergency that started Friday and they wait until Monday and now we've got a full blown emergency. So how I would like my clients to react is how I went about teaching, and that is reflected in that emergency chapter with, some stories that are not, they're serious and they're worst case, and some are more educational and not a whole lot of humor, but I think they make their point, and I think it's really important things that people should know, and I wish my clients would know.
Absolutely. And I love that. I mean, to be able to inform people, even just what to expect, I think makes a big difference, particularly in the euthanasia process, because it's such a traumatic time. And often, even in the moment, if you try and communicate that, you're not in a state of mind where you're going to receive that information like you would if you were reading about it and sort of preparing yourself. So to have that opportunity, I think that's really valuable what you're doing. In terms of, so you did some clinic work and you've been doing some house calls. Can you give us an insight into how the work that you were doing then varied, and some of the pros and potentially some of the struggles? Because obviously I run a 24-hour practice here in South Africa, and doing a house call is sometimes really challenging, but it's really important to some owners. Can you give our listeners a sort of a bit of an insight into how it varies and what the pros and cons are?
I am able to walk into a home, even with longer time period allotted for the visit. I actually think sometimes I save time just by walking into a home. I immediately see where they eat, how much they eat, how many stairs they have to climb. Are there other pets that are a source of stress in inter-animal behavioral issues that are complicating my treatment plan or that are causing disease or anxiety, and which in the brick and mortar setting would be a series of questions that I can glean in 15 seconds or sooner. And so I think that I have a distinct advantage in that capacity. I did the house calls towards the end of my career, later in my career. Could I have done that immediately after graduating? Probably would not have. I needed confidence. You walk in, they're watching you take blood. It's kind of daunting, and some people are really good at it early. Mm-hmm. I'm glad I had about 20 years experience prior to that, because I work alone. I have assistants. I couldn't work without my nurses, but there was no one to feed off ideas. And so you have to think on your feet, and experience and time helped me. So, it's a great thing, particularly in home euthanasias, I feel, are the final gift that you can give pets, and would have never thought to do it myself until I performed them. And now I've done it a couple hundred times, including for my own dog. I had someone come in, and so I strive to explain that aspect for people to even consider it, because, you hate when people say, I wish I knew before. So now they'll know.
Absolutely. No, so true. And I think, from the small amount that we pick up, even from the waiting room walking into the
Right.
consult room, the behavior, their body language, how they walk into the room, how they're breathing. There's so many subtle cues that you pick up that you can gain even before you touch that pet,
Exactly.
that you get even more insight if you're at a home. And like you said, you're able to assess normal behavior because that is how they would behave. Whereas often our patients are stressed, or they, particularly cats, they've had a journey in here, their temperatures change, their respiratory rates all over the place. And so, yes, the benefit of going into home is actually seeing them in a sort of perfect setting in terms of
Perfect.
being able to
Yes.
assess them.
Most of
Other
them.
than the ability to have an assistant, which was always the struggle.
Well, I wouldn't say they're happy that I'm there in their home, but they're
No.
definitely happier than they would be in the clinic. And cats, it's a game changer because you have a very short window of time at best, in the home. By the time the majority, and I'm sure I'm not preaching to the choir, they're done stress wise by the time. Like, try getting a blood pressure that's accurate in a hospital. I mean, we have to tweak it. And I do think that, the far majority are more relaxed. I see a lot of cats, a lot of behavioral issues, some of these patients that just they don't do well at all. And there are several stories of, pets that were notoriously unmanageable in the clinic. And I was a little, scared of what would they be like in the home. And the far majority, with few exceptions, are better. But you have to be smart. You have to be efficient. I instruct people to put cats in a powder room where they can't hide under furniture. The house call chapter is full of all sorts of, going under beds, of course, because so many people just say, no, he'll be fine. And they're not. And then we do
or they've got out.
we just,
in South Africa, we often find you arrive and they've let the cat out. They're like, oh, he should be home soon. And then you're calling all over the garden.
and
trying
an
to
hour
get the cat
later,
back in.
you're stressing them. So
tick,
there's
tick,
lots
tick.
of very, I think, entertaining and interesting stories on that nature. Large part devoted to cats, not exclusively, but they are unpredictable, fast moving creatures that make every day an adventure, in my opinion.
Absolutely. And in terms of limitations, obviously, do you educate owners in terms of the things that cannot be done in the home environment, that if they go into the clinic, like x-rays and ultrasounds and potentially, obviously, you can collect blood, but sort of immediate blood work and that sort of thing. Do you discuss in terms of obviously the benefits, and situations like euthanasia are incredible. I agree with you. I think there's no better place. But do you discuss some of the limitations so that owners are aware of those?
Right. So what was important to me, because I really have a lot of, and the 20 years prior to and since it, working up very complicated cases, my strengths are more internal medicine. I stopped doing surgery myself, for various reasons. And I offer full service. What I cannot do in the home, I have relationships with brick and mortar practices, and those services are done there. And that was the only way I was willing to practice with. And, when you have a client who you want to take on a new client, I need to say to them, I'm not available. It's just me. I have certain days of the week, but you can have full service. For them to leave a brick and mortar practice that has it, it's a leap of faith, and that they were able to trust me and work with me, and which is why my patients and house call clients are so dear to me, because they did, I got to know them so well in their home and see them in town. And so the rewards of that were greater than I even imagined. And I live near a park, and I'll be jogging or biking, and I'll see clients and, oh, how is, Fluffy's rash? And I'll get updates on the fly that I really do see them in the community and often. And I used to be very private. And then all bets were off once I started the house call practice because so many were neighbors. And I certainly am still, but I pick my clientele carefully, and they really researched and had to know and accept that. And it worked very well. And for me for 10 years, I moved. So I found them a new home. There's in the US, a company that is exclusively house calls, but has arrangements with brick and mortar, purchased my practice because it was difficult.
Wow.
Not enough vets to go around. And so I was so anxious until it was purchased by them. And so now they are in good hands, I'm happy to say. And I get updates from
great.
afar, but that's a trade-off for having a house call practice, is the limitations.
Absolutely. So how did you manage the boundaries? How did you, or the stressful situations? What were the sort of things you did as an individual to sort of say, well, I'm not available. It's time off, because I can appreciate, especially when you have close relationships with people, they expect you to be on the other end of the phone, or if they know where you live and you're part of the neighborhood, to interrupt your run, for example, in the park, and you're going, this is my time.
Well, that was
How
a
did you
struggle,
manage that?
and I learned the hard way. I did some things wrong and learned the hard way. I eventually had a service take my calls. I had a very few exceptions, stuck to my schedule, which was largely dictated by the availability of my nurse assistants anyway. So you make an exception to do a Saturday night or a Saturday evening appointment with a client who works full time. They're only going to want evening appointments. So I stopped adding those on. And I had a message saying, referral, I'm not checking this for at least 24 hours. If you have an emergency, go here and here. And I got better at setting those boundaries. I talk a lot in the book about, I never, ever answer the phone until there's a voicemail. My phone is always on quiet while working, to not be interrupted, but also to digest and request detailed messages, because one person's idea of an emergency that needs to be called back may not be my definition, as we talked about stress levels of pet parents. So I learned to say no in the proper way, and to set boundaries, and in very few cases wouldn't agree to have clients or fired clients that were not respectful of those boundaries, because my quality of life and mental health is very important. And so I stepped back from being a yes person all the time. And, we have this issue in veterinary medicine. It's very, very easy to be overwhelmed. That's another topic I touch upon briefly in the book, about the emotional toll it takes doing what we do, because we have a lot of death. We have a lot of, not everything is a successful outcome because it's health. But also the demands of the job are physically and mentally, and, you're thinking, and I love that variety, but it can be exhausting. And so you need to step back. And I do talk a lot about, in the book, as a veterinarian, I wanted people to understand, because I don't know how it is where you are, but people are always like, vets are just in it for the money, and on social media, which is a double-edged sword. And so I wanted them to see that if I was in a career just for the money, I think I would be in a different career. I mean, we care. This is why we do what we do. This is how we react. I wake up sad the day I have to euthanize a patient that I've had for years. I'm sobbing. I mean, there is no emotional detachment. And you're better at hiding it than others. I go into all of these emotions, my own, not for people just to sympathize with me, but to kind of say, I'm speaking for myself and for my colleagues. Like, this is how I am, but it's not just me. And I hope you love your vet and find someone that you really love and trust, because we love these great clients and patients, and I want them to know that as well. It's a personal relationship, and I don't think people get that, and I hope that they get that in part from my book.
I love that you're doing that, and I love that you're educating in a way that is lighthearted, and also, the ability to pick up your book allows people to digest that information at their pace.
Right.
And when they need it, a bit like the podcasting situation, when you may not watch a podcast on itchy skin, but when you need it, rather have a credible source in order to gain that information than, hear someone else's, because people naturally talk about negative experiences. Not, most people take on a good experience, absorb it, and then let it pass.
Right.
We all sit with the traumatic or the negative things, and it's far easier to sort of relay those messages. So I love the fact that you're writing about this and informing pet owners. So thank you very much for what you're doing. I'm very excited to make a recommendation to my clients and to my listeners to read your book. And I wish you all the success for your final release date.
I am, so thankful for that, and for having the opportunity to speak with you and sort of meet your clients through your podcast. I love podcasts. I hadn't known about it until now, but I will listen, and I'm a big audiobook, driving. I listen to podcasts and audiobooks all the time. I think that they are probably more popular than, books in print for so many, or gaining in popularity. And so I'm just so grateful, and I'm so excited to talk to another vet on the other side of the world.
It's been so nice.
I appreciate you taking the time to reach out.
Thank you for being so open and for sharing some insights. I think it's certainly got me excited about. I obviously had the privilege of having a sneak peek, but I'm very happy it's nearly weekend, and I'm going to have a good read when I've got a little bit of time off. So thank you. It's very exciting. I look forward to following your journey. Thank you so much, Dr. Dawn, for sharing your stories and insights with us today. It is clear that Tales of a Pet Vet is more than just a collection of stories. It's a love letter to the profession and to all the pets and owners who have touched your life. For everyone listening, be sure to check out Tales of a Pet Vet. It is a must-read for anyone who loves animals or wants to understand the magic behind the bond between pets and their vets. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.